Johnson & Johnson's COVID vaccine will be made available to the public again, ending an 11-day pause initiated after a rare blood clotting disorder was associated with the shot. If you guys received your shot, drop the comments below. If you have not, still drop the comments below. I'm curious to see how many of you guys have actually received the shot. Have there been effects? Are you afraid of it? Drop the comments below. Let me know what you guys think. Now, the Food and Drug Administration and Centers for Disease Control and Prevention determined the benefits of the J&J vaccine outweighed the risk of keeping it off the market. 8 million who received the vaccine, 15 people have developed the condition, and 3 have died. The two agencies held a joint news conference Friday evening to announce their decision to allow distribution of the J&J vaccine to resume. Both agencies have full confidence that this vaccine known and potential benefits outweighs its known and potential risk in individuals 18 years and older, said Dr. Janet Woodcock, the FDA's acting commissioner. The J&J vaccine should be available almost immediately by tomorrow morning, even said by Dr. Peter Marks, the director of FDA's Center of Evaluation and Research. Everyone who receives the shot should receive an information sheet mentioning the rare clotting problem and the symptoms to look out for. Officials said providers also will be given information about the condition and the appropriate treatment for managing it. Now, this side effect has not been seen by the other two vaccinations that have been approved by the US. 130 million Americans earlier Friday, a CDC committee voted to resume distribution of the vaccine. Alright guys, so I want you to drop your comments below. Let me know how you guys feel about this. I do want to let you guys know I'm still doing a giveaway at the end of the month. The 30th of each month, I am doing a giveaway. So if you guys want to be entered in a giveaway, all you guys got to do is like and subscribe to this video. I actually got a playlist that says giveaway on my channel if you guys want to be entered. The J&J vaccine in the United States will prevent 1,400 deaths from COVID-19 units. According to a CDC analyst, it could cause approximately 24 cases of TTS, a CDC staffer said. Now, 3 of the 15 unknown patients have died. That's roughly 20% of those diagnosed with TTS. The J&J shot has been especially popular for use in difficult to reach populations, such as people experiencing homelessness, the homebound. Now, here's a quote from an American: "We really depend on this one dose and you're done vaccine. But if they're unlikely to come back for a second dose, then they are far better off getting the J&J than getting a single shot." Now, this is all really personal preference. I know a lot of people out there who don't like shots, so they're like, I want the single shot, and that single shot is the J&J. Now, if you guys wanted multiple shots or the 2 shots, there are different brands of those shots. As we talked about, there's 2 different companies who offers that. J&J just seems to be the one that people can, it's more accessible to the people who can't go to hospitals, who can't go to these higher up places. So J&J, that's where they come in at. It's less likely to get a second dose, then you are clearly benefit from 1 dose of the J&J vaccine, which includes the kind of cellular immune response that is not induced by the first dose. So you're getting something that's not even in the first dose if you guys get the J&J vaccine. Now, Americans also want to have some choice about which vaccine they receive, said Dr. Beth Bell, a committee member and professor of global health at the University of Washington. The United States remains in the middle of a COVID-19 outbreak and could change as more information about the risks and benefits of the vaccines become available. Several panel members praised the CDC for recognizing and acting on the safety concerns so quickly. The FDA and the CDC first recommended the pause on April 13th after several reports of unusual blood clotting conditions showed up in the CDC's vaccines monitoring system. Friday, as the CDC gathered more information on the condition and more cases could potentially be identified. At that time, there were 8 known cases of the condition. It was very reassuring that so few additional cases have been identified since, said Lee. The last 11 days for me have been reassuring in that we haven't identified hundreds of more cases despite enhanced focus, which was my worry last week, she said. Last week, I would have made a different decision than I would this week. So it's good that they're coming to their senses. They're analyzing any data that we have. They're analyzing everything and figuring out where is this coming from. There's been blood clots and numerous people, and as we talked about, few have died. So guys, be careful out there if you are getting this. vaccine. And even if you aren't, and that's just a tough situation we're in, because it's like we need the vaccine, but it's like the vaccine is making people sick. People have died from the vaccine. So it's a very, very tough situation that we're in, especially as the American people, where people need vaccines. Then you got people who don't want the vaccines, but then they're putting themselves at risk. So it's like it's a risk either way we look at it. And it's tough. It's a tough situation. Trust me. Most of the blood clots are in the brain, although several were in the abdomen. Public health officials have warned that anyone who develops a severe headache or leg or abdominal pain a week or two after the vaccination with the J&J vaccine should seek immediate attention. This side effect is different from the initial reaction to the vaccine, which start a day or two after a shot and short lasting. So if you guys got the shot, wait about a week or two, and if you guys feel anything not normal, go to your doctor as soon as possible. I will just wait a couple of days. This is a serious matter. Literally, I will wait a couple of days. They're saying wait a week or two. If you guys feel something immediately, now I understand if you guys don't feel anything, but you just have to take precaution. You don't want to risk it. You don't want your body. You don't want this to react to your body a certain type of way. The benefits of the J&J vaccine still outweighs the chances of the very rare side effect. So they're still going to push this. It's out right now. If you guys want to get vaccinated, you have options, guys. So look into your options. This is one of the options, and it looks like they're putting this back on the market in disregard of the deaths that have happened. Not saying, we don't know if this is going to increase or decrease, but as of right now, there has been deaths behind this vaccine. So guys, just be careful out there. I really hope you guys enjoy your day. If you guys got any questions regarding this, regarding any other topics, feel free to drop those questions and comments below. My name is Quentin Banks. Hope you guys enjoy your day. Go out there, be great. Go out there, be amazing. Go tell somebody you love them. Give them a high five. Compliment them. You guys know the deal, right? You guys know the deal. Stay loyal, stay blessed, stay true, stay you.
Because that could lead to identifiable information. However, I can share that her symptoms did present within 2 weeks of vaccination, so it's consistent with the cases observed before hers. We expect the CDC to identify and kind of comment on some of the remaining tests that were remaining at the time of our last discussion. In addition to that, it might be about a week or later before they're able to conclusively decide on the cause of death for any of the individuals outlined so far. I don't have information regarding other cases. We're just reporting the one death that we were made aware of. Fortunately, the treatment did occur in the wake of the announcement of the pause, so the appropriate treatment was undertaken and heparin was avoided. I don't have information regarding other cases. We're just reporting the one death that we were made aware of. Fortunately,